Welcome to another deep dive. Today, we're tackling something a lot of people wonder about. Finasteride versus dutasteride for male pattern hair loss.
Right. It comes up a lot.
It really does.
Yeah.
And look, it's not just about picking the, stronger drug. We want to understand the science, the practical differences.
Exactly. What's under the hood?
We've gone through a bunch of your sources, clinical trials, reviews to kind of cut through the noise. Our mission for you today, give you that shortcut to understanding this decision. It's nuanced. Okay, so let's unpack this. Both drugs target androgenetic alopecia AGA or male pattern hair loss.
Yep.
They both go after DHT, dihydrotestosterone. That's the hormone that shrinks the hair follicles, right?
It's the primary culprit, yes. But they don't do it in exactly the same way.
Okay, how so?
Well, it's about the enzyme 5-alpha reductase. That's what turns testosterone into DHT.
Right.
And what's interesting is there are actually 3 types of this enzyme, types 1, 2, and 3.
3 types, okay.
Finasteride is selective. It mostly inhibits type 2 and type 3. These are the main ones in the hair follicle, which is why it works.
Gotcha.
And that usually leads to about a 70% drop in DHT in the blood.
So 70%. Okay, so what about dutasteride then? Does it work differently?
It does. Dutasteride is what we call a dual inhibitor. It goes after all 3 types 1, 2, and 3.
All 3, so it casts a much wider net.
A much wider net. Type 1 is also found in scalp skin and sebaceous glands, so blocking it too gives you a much more profound DHT suppression.
How profound?
We're talking 90, maybe even 95% reduction in serum DHT. Sometimes even more suppression right in the scalp tissue itself.
Wow, okay. 95% versus 70%? That's quite a
It's
change.
significant, yeah.
Okay.
That comprehensive blockade is really the key difference in mechanism.
So the big question then, does that extra DHT smashing actually mean, better hair growth?
Yeah.
Do you see a difference?
Yeah, that's what the evidence suggests. The clinical data, especially when you look at studies comparing them directly or these big meta-analyses, they consistently point to dutasteride being, well, the most effective oral treatment for AGA.
Really? Quantifiably?
Yes. One review found, on average, dutasteride led to about 28, almost 29, more hairs per square centimeter compared to finasteride.
28 more hairs. That sounds like something you might actually notice.
It's considered a clinically meaningful difference, yes. You could potentially see that improved density.
Okay, but there's always a but, isn't there? More power often means more things to consider, like side effects.
That's the crucial balance, absolutely. Both drugs share similar potential side effects.
Like the sexual side effects.
Exactly. Things like erectile dysfunction, lower libido, they usually occur in a small percentage of men in the trials, low single digits typically.
Okay.
But more recently, regulatory bodies like the EMA in Europe have added warnings.
About what?
Psychiatric risks, things like depression, even suicidal ideation, particularly noted in younger men.
That's serious.
It is, and it brings up that whole controversial topic of post-Finasteride syndrome, or maybe post-5-ARI syndrome, since it could potentially apply to both.
Where symptoms stick around even after stopping the drug.
Precisely. It's still heavily debated, needs a lot more research, definitely, but there are theories emerging about potential lasting biological changes. It's something people are talking about.
Definitely something to be aware of. But you mentioned a practical difference, maybe the biggest one for someone experiencing side effects. The half-life.
Ah, yes, the half-life. This is honestly a game changer in the decision process for many.
How so?
Finasteride, pretty short half-life. We're talking 6 to 8 hours. So if you stop taking it,
It clears out relatively quickly.
yeah, it's largely out of your system within, say, a couple of weeks usually.
Okay. And dutasteride.
Hugely different. Extremely long half-life, about 5 weeks.
Weeks. Wow.
Yeah. Which means it can stay in your body, detectable, for months, many months after you stop.
So if you get side effects on dutasteride, you're kind of stuck with it for a while.
That's the implication. It's a much longer commitment. Finasteride is like, maybe a short-term rental, easy to leave if there's a problem. Dutasteride is more like signing a long lease. You need to be prepared for that longer presence if things don't go well.
That's a really important practical point. So wrapping this together for someone listening, finasteride is FDA approved in the US for hair loss, right? Widely used.
Correct. Standard approval, widely available globally.
Dutasteride. Approved in some places like Japan, South Korea, specifically for hair loss.
Yes, it has specific approvals for AGA there.
But in the US and Europe, it's technically off-label for hair loss.
It is. Though off-label doesn't mean experimental or untested, just that its primary approval might have been for something else, like BPH, and doctors use it based on strong clinical evidence for hair loss.
Right, okay. So it's not a simple, this was better situation.
Not at all. It's very individual.
So maybe for someone just starting out, maybe worried about sides, wanting that quick off-ramp, finasteride seems like the logical first step.
Often, yes. It's the established go-to, shorter half-life, gives people peace of mind.
But if maybe finasteride didn't work well enough for you, or you have aggressive hair loss and really want maximum effect.
And you understand, crucially, the implications of that long half-life.
Right.
Then dutasteride might be a conversation to have with your doctor. A thorough conversation.
Absolutely. So whether you're thinking about treatment or just curious, really understanding these differences, the mechanism, the potency, and especially that half-life, it just empowers you.
Lets you have a much better, much more informed discussion with your doctor.
The goal is always aligning the science, the data we've talked about, with your specific health situation and what you want to achieve.
Couldn't agree more.
Makes you wonder, doesn't it? What other medical choices have this kind of clear trade-off? Established safety versus maybe more power, but with a bigger commitment. Something to think about until our next deep dive.